Omicron has been reported in 57 countries, and WHO expects the number to continue growing. So by the end of the year, they are hoping that more than 57 countries would have recorded this new variant, the Omicron. And Ghana is part of that 57. We know already that Omicron has been recorded at Kotoka International Airport after sequencing of some positive cases from travelers. So all countries have been also asked to increase surveillance, testing, as well as sequencing. And that's exactly what we are seeking to do as a country also. So key question tonight is the dreaded fourth wave of COVID-19 upon Ghana? That and more are the questions that we are seeking answers to tonight. Stay with me as we probe the measures in place as the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, joins me tonight on The Probe. We're live on the Joy News channel, also on DSTV 421, GoTV 144, on Joy Prime. We're also on Joy 99.7 FM, Love 99.5 FM, myjoyonline.com. We are streaming live on Facebook, YouTube, and of course on Twitter. It's a good time to fire your questions for responses so we deal with this health emergency. But before then, I don't know the last time that you went on the Ghana Health Service website to check on our COVID statistics. Well, tonight, I'll walk you through some of them. Our new cases as we are recording is 31. Well, our confirmed cases, 131,412. And then we have our recoveries and discharges, 129,495. Our deaths stands at 1,239. So this is the COVID statistics as we have it. I know you have not been checking, but I hope you have not let your guard down. But our new cases are 31. That's where we stand, and our active cases remain at 678. We have the regional breakdown also. Greater Accra still leading. The Ashanti region next with 20,726. Western region, 7,549. The Eastern is 6,605. The Volta region is up next with 5,412. So that's where we are when it comes to COVID-19. Thankfully, our new cases is at 31, and then active cases 678. Are you wearing your mask? Are you letting your guard down? It's a good time to pick it up. I'll be right back when Dr. Patrick Kumabwaji joins me. Welcome back, and many thanks for your company here on tonight's edition of The Probe. We're live on the Joy News channel, also on Joy 99.7 FM. We're also live on Love 99.5 FM in Kumasi and over 30 affiliates dotted across Ghana's 16 regions. On Joy Prime, also on DSTV is 421, GoTV is 144, myjoyonline.com, also streaming live on Facebook. We'll see you, and you can post your questions there as well, and we'll take it for Dr. Patrick Kumabwaji. I'll introduce him to you shortly because there are a number of questions that you've sent in that you're hoping to get responses for. But we set the pace with these two statements that were issued this week by the Ghana Airports Company Limited just yesterday, or just about the early hours of today. And then earlier, the Ghana Health Service, which this statement was signed by Dr. Patrick Kumabwaji himself earlier, also on this directive, knowing that we had recorded Omicron. So I'll start with the Ghana Airports Company, that statement that they issued effective 14th December 2021. So they've talked about pre-arrival processes. So travelers intending to enter Ghana, this is what you need to know. All international passengers, including those from the ECOWAS region, intending to fly to Ghana will be required to meet the following health requirements prior to admission into Ghana. So it includes, first, for passengers who already have a Panabios account, you need to enter your country of origin and set the destination to Ghana. This is what you need to know. And passengers who do not have that account should create an account on the AU Endorse site, amongst others. And then when you finish that process, if you take your test at a TT lab, you need to give the lab the same email address to open your account. The results will be automatically delivered to your account bearing that. So this is for passengers intending to enter Ghana. This is what you need to know. Now, for passengers arriving, that's travelers entering Ghana, all passengers or all persons 18 years and above arriving in Ghana will be required, and this is in red because you need to know, will be required to provide evidence of full vaccination for a COVID-19 vaccine at the point of embarking. And the definition of fully vaccinated has also been explained, and the Ghana Health Service has also taken us through that. So you need to have taken the full dose of vaccines approved and registered by the Food and Drugs Authority. And now you also are required to take the full dose of vaccines that are on World Health Organization emergency use listing. However, persons who are vaccinated with vaccines on WHO emergency use listing but not registered by Ghana's FDA for emergency use authorization will be offered one of the FDA Ghana-approved vaccines on arrival at the airport. Now, all unvaccinated Ghanaians and residents of Ghana who are currently outside the country and intend to return within 14 days from midnight of 14 December 2021. This is what is required of you. We'll go through that portion also, if we could just go through the second page of that particular statement. So this is what you're also required. And they would also, however, be vaccinated on arrival at the airport. Now, it goes on to say that airlines that bring passengers to Kotoka International Airport who are not fully vaccinated shall be surcharged $3,500 per passenger. So this is to the airlines. If they're bringing any passenger that is not vaccinated, they'll be surcharged $3,500 per passenger. We know that there was a similar system in place for those who brought in people who had not tested or had not paid to be tested at the Kotoka International Airport. It was up to $5,000. Now, all passengers are required to present evidence of having filled Ghana's health declaration form. You know that's what has to be done. And then airlines that bring passengers to Kotoka International Airport who has also not filled this HDA form shall also be surcharged another $3,500 per passenger. I'm sure you're working the mathematics there. That's up towards $7,000. Now, passengers must not have symptoms suggested of COVID-19, including body temperature of up to 38 degrees Celsius. So these are the requirements, the latest, that will take effect from the 14th of December, as put out by Ghana's Airports Company Limited. So arriving passengers will also undergo temperature screening. All the processes are there and it's been reviewed. And Ghana residents who depart Ghana and return within 1 week will not be required to present a COVID-19 result from the country of departure. They will, however, undergo mandatory COVID-19 testing upon arrival in Ghana. So that's what is required. The testing is still on. ECOWAS citizens, you're paying $50. So this was an statement that was issued by the Ghana Airports Company Limited. Earlier, the Ghana Health Service, the Director General, who is my guest tonight, also issued a statement about the measures that they've put in place with the onset of Omicron. So this is what it also says. I'll go through that statement that's issued by the Ghana Health Service. And this one says, it talked about the decline in the number of COVID-19 cases in Ghana over the past 2 months until the COVID-19 onset with the Omicron variant that was detected in South Africa. It was detected by scientists in South Africa. So a number of travelers from these countries come to Ghana, and this is expected to increase during the festive season. So this current surge in COVID-19 cases is being reflected at the Kotoka International Airport. That's the communication. In November 2020, 168 cases were detected compared to 241 cases in November 2021. An increase of over 40%. So these are the measures they put in place as a result. They say we have since been recording an average of 20 positive cases a day at KIA. So for these positive cases, there is a significant difference in the percentage of COVID-19 infection based on vaccination status recorded at the KIA. So available data from KIA show that a COVID-19 positive person is 3 times more likely to be unvaccinated. So if we scroll down a bit more, it tells us that to avert this, the following directives are to be implemented effective midnight, 12 December 2021. Today is 12 December 2021. So if you are travelers to Ghana, this is what you should know. That's according to the Ghana Health Service. All persons 18 years and above arriving in Ghana will be required to provide evidence of full vaccination for a COVID-19 vaccine. All unvaccinated Ghanaians and residents of Ghana who are currently outside the country and intend to return within 14 days from the midnight of 12 December 2021 are exempted, however. they would be vaccinating on arrival at the airport. Now, if you're traveling out of Ghana, this is what you should know, according to the Ghana Health Service. All Ghanaians traveling out of the country are to be fully vaccinated, effective midnight, 12 December 2021. Now, it talks about the definition of fully vaccinated. You know, you need to get the full dose, 2 doses. You need 2 doses of AstraZeneca, Pfizer, Moderna, or Sputnik V to be declared as fully vaccinated. And then 1 dose is required for Johnson & Johnson to be declared fully vaccinated as well. Now, COVID-19 vaccines approved and registered by FDA is also outlined, which we'll get into. So AstraZeneca, Sputnik V, Johnson & Johnson, Pfizer, and then Moderna. Now, other arrival requirements remain unchanged, which is the 72-hour negative PCR test requirement prior to travel, completion of the health declaration form. All persons who arrive in Ghana will undergo antigen tests in spite of the vaccination. So these are some of the questions that you are asking as to why you still need to go through this if you have been vaccinated. And that's why Dr. Patrick Kumabwaji himself, the Director General of the Ghana Health Service, will be on hand to give you all the answers you require this evening, because we've seen a number of your questions that you've already sent in. I'll go through them quickly, because now we've set the tone. You know, the statement from the Ghana airport, and then also the statement that was issued earlier by the Ghana Health Service Director General, Dr. Patrick Kumabwaji, who is my guest tonight here on the probe. All is set now. We'll go through the messages that you've also sent and the questions and the comments right here. And if you haven't done yours already, it's a good time to leave them on our social media platforms and our WhatsApp platforms as well. And we'll take answers. Good evening, Mr. Patrick Kumabwaji.
Good evening, sir.
We are grateful for your time here on the probe tonight. Been a while.
Yes.
Good to see you. Okay, so I've seen 2 statements from the Ghana Health Service. And then there's the latest one also from the Ghana Airport Company Limited, which was today. Safe to say that the airport company one takes precedence over what we've seen earlier, or they're all working on different tangents?
Thank you. We're all working the same tangents.
Okay.
Our announcement was more of an alert to get people to know. When we engaged, we felt that they needed more time for the airlines to prepare not just the client but also their own staff, and so we needed additional time for them to be more effective. So yes, we have revised the date from 12th to the 14th, which means that the 26th also become 28th. Just push it for about 2 weeks to accommodate some of the challenges that are likely to.
Was it as a result of concerns that has been raised, or what exactly could have been resulted in the shift in terms of 2 days or so?
Well, I think we had built consensus on that before, but then the airlines came up with a different challenge, and we felt that we needed to work with them to be able to make it more efficient. That's why we agreed to do reshift. So it was not because we are not consulted the Ghana airport, but at the end of the day, they will do the more verbal and engage the airlines, and so when they come back to us and we agree. So while ours was more of the alert to let the population know this is what is coming. The finals ones are the kind of thing that we are currently seeing, including a little update on the vaccines that will be used. And one of them is we have included the WHO emergency authorization listing. These are vaccines that have been approved by WHO, not yet approved in Ghana. And we felt that for now we could also add them to be part of the qualification to enter.
So safe to say that all the airlines, because we know there's a surcharge for if a passenger does not fill the health form, that's 3,500, that's separate. And then also if unvaccinated traveler, also you're going to be paying 3,500.
Including those who also come in without a PCR negative results.
Okay, that's $3,500. They are all aligned in this, you would say?
Well, that would be for airports. I've seen a lot of that. That's whether they are together or multiples. I believe each charge carries its own penalties. Okay.
Well, so we'll get to the questions, but there are a few clarifications that we need. First off, do we know how many Omicron cases exactly after the sequencing that we've recorded in the country?
Yes. We saw the first group of about 34. That was those at the airport. At the time, we had sequenced about 66 community samples that were negative. Okay. The current one is giving us some Omicron in country I think about 7 of them have been reported within the community sample, but that is to be expected because we are letting as people enter, they are more likely, we maybe have people who are incubating, so we have seen some now, but still the leading variant is still the Delta among the community.
Okay, so you've talked about 66 communities. Earlier you said 34, but I was asking if we know how many exactly in terms of Omicron after the sequencing, because the earlier communication was 34. Has it increased? Do we know how many exactly?
The 34 was for the 116 at the traveler that was done. At that same time, we had done about 66 community samples, which were labs within country, and that's 0 for Omicron. The second batch, and I think about 40 or so, we have seen some Omicron in country.
And you say that is 7, so in addition to the 34, that's all?
That's what we know.
Okay.
That's what is recorded.
Okay. Well,
so as you go on to do your sequencing, you may find some. The most important thing is that it is in the community, and so that's what the caution for us to be more careful.
So are we chasing it? Do we know we are in control? 7 in which communities you would want to tell us?
The most important thing is that all the preventive measures that apply as to whether it is prevention through the mask wearing, hand washing, social distancing, they still work. Vaccines still work. Even though there is some evidence of some escape, it still works. So all the measures that we have still applies. What we need to do is intensify it and make it more effective to prevent transmission from one person to another.
So it's a variant of interest, as the WHO has described it. Are we in control of it? You say Delta is still leading, but Omicron is also with us, upon us as a country.
Well, I think it is not about whether you're in control of Delta or Alpha. Are you in control of the virus? Are you able to, do you have systems in place to prevent importation or reduce importation, system to reduce transmission from one person to another? Do you have the system to be able to manage those who unfortunately get the virus and get sick? I think that is what we continue to do. And I think so far, we feel that the right things have been done.
Are we testing as much as a country?
We have a very straightforward testing policy. We find a symptomatic patient, we test you are positive, we test all your contacts. And so the fewer the contacts, the fewer the tests. The more your contacts, the more positive cases. That will determine how much. We haven't stopped that. Anybody who does that, we look at. When we see at-risk group, we do random testing to see whether there is some. And that is what has continued to give us. There are times we were getting 1,000 a day, the same policy. When we get 2 a day, the same policy. So that's what is happening.
So these 7 Omicron cases in the community, how many contacts are we looking at in terms of testing and all that?
You see, why we do is that we pick these samples at random. Okay. So they are part of the team that we have actually contacted already. So once they pick at random and test, sequence them, that's when they do to see. So
you mind sharing which communities exactly?
Oh, not, it's really not necessary.
It's not.
Not necessary.
Okay. Well, is the 4th wave, the dreaded 4th wave of COVID-19, is it upon us as a country?
Well, I think all of us, both the people, the health workers, and everybody who play a role in ensuring that either we avert it or reduce the impact. And so if you look at what is happening, that's what led to some of these changes that are taking place. That last year, as you saw in the release, in the whole of November, we saw 168 positives at the airport. So that airport testing and the positivity is a very good indicator for what is coming, because you can see that our neighbors, most of the people traveling to the country, they are having their 4th wave, they are having surges in their country. This year, as at the end of November, we have reported about 240. And so if you saw what happened in January this year, then that tells you that we need to be more cautious about what is coming in. This, and then subsequently, we've been doing average of 20. Yesterday, we saw about 51 positives at the airport. You see, so that tells you that that was a major risk for the country. And so we need to do something to reduce the importation by ensuring that people who are vaccinated are the ones who are coming in. And some of the data we are seeing that about 75% of all the people who test positive at the airport are unvaccinated. And so if you reduce that number, obviously the number of imputation will significantly come down. The fact that also when they get sick because they are vaccinated, they recover very fast or they don't even fall sick. So there are benefits to the vaccine. That's why we need to push and make sure we also protect our people. We have, I would say, 14 million or 13 million people who should be vaccinated, who are yet to be vaccinated. And so our policies must be more stronger in protecting them whilst we continue to vaccinate. So comparing our policies with others, if you have vaccinated 80% of the population, what you put out there is different from a country that has vaccinated less than 30%. Okay. So the risks are higher, so we need to be more aggressive.
So what would be your straightforward yes or no answer if I ask if Ghana is in the fourth wave of COVID-19?
Oh, no, we wouldn't say we are in the fourth wave at all. What we are in is that we have seen signs that if we don't take action, we can lead it. And last year we saw it, and you all saw what happened, and then how we ended up where we are. So we needed to look at it. And a lot of the things we realized there was the Christmas parties and all those small groupings that cascaded into January. By 28th, 29th of January, the numbers have started going up. And then once you see that, it's always already too late because the people are in there after Christmas, they are coming to work, they're coming to mix, and then it becomes an exponential spread. And that's what we're trying to avoid. Okay, so we'll interrogate the measures that we put in place because there are a number of questions on that. But we had a target of 20 million to be vaccinated by 2021. We're in December. Today is the 12th. How many people have we been able to vaccinate out of that targeted number? I will say we've done about 6.5 million, as I see on my dashboard. Okay. But because of data, a lot of the regions upload their data later. And so you may see 6.5 today, you can see 7 million tomorrow morning. It depends on how they update it. So I would like to talk about the ones that we have uploaded whilst we continue. But we also get direct information from the regions. And that's why I'm sure that we have vaccinated more than what appears on our dashboard. But I would like to respect the dashboard. We want to ensure that everyone is entered in the database so that if you need to be verification, then it's there to verify. And that's less than half of the targeted number, at least. If you add whatever it is that you have, do we have plans of at least hitting the 10 million? I know December has been declared a vaccination month, and that of January as well. We have plans. We have plans to look at that because we are during the month, we are doing campaign. We are moving into a campaign mode somewhere early next week. So that'll be everywhere. And knowing our capacity to vaccinate, we should be able to meet the target because you have the vaccines. What is most important is for the people to make themselves available to be vaccinated. That we can push, but will be a limitation if people are not making themselves available. The system is ready, the vaccines are there, all the logistics for that is available. We are moving into campaign mode. We need to get people to see the value in the vaccine and make themselves available to vaccinate. How much of these vaccines do you have? Oh, we have more than 7-8 million in stock. We are expecting about 10 to 11 million in the next week. 2 days ago, we received 2 million, so that makes the 7 million about 9 million. I'm using that because we are vaccinating every day. Okay. And so the stocks keeps on looking at. And we have the capacity to store ultra cold vaccines. That's why we have Pfizer, we have Moderna, we have Johnson & Johnson, we have AstraZeneca. These are available, and in all regions of the country, vaccination is ongoing. Okay, let's go on Facebook and take some of the questions that you've sent in. This one is asking, please ask him why they are not going to allow Ghanaians living abroad who are not fully vaccinated to enter the country. Is it that they don't trust the test at the airport anymore? TJ Wara, that's your question. Frank JC says, are they going to vaccinate learners in basic schools? That's JHS. That's Frank JC asking. The next one, Sarah Oti says, I have some concerns about the latest compulsory vaccination for those coming into Ghana and even those going out. Have we done what we are supposed to do in terms of putting in place the appropriate legal regime? That's Sarah's question. Michael Opari, still on Facebook, says, do we have enough vaccines for every Ghanaian coming in? Can we afford that? Michael.
John Asante says, why are we asking people to vaccinate, yet they will still take the test when they arrive at the airport? Can one not be a substitute for the other? I think we'll leave it here for the first batch and then take responses to them. We'll start from the very last one. Why people will still have to vaccinate and still take the tests when they arrive.
Well, thank you very much. I think we are looking at the behavior of the virus. There are countries that you go in fully vaccinated, but they will quarantine you for 2 weeks, even when you are fully vaccinated, before you are released. And so looking at that, so we do the PCR, all of them do PCR negative before you move in. If those who are fully vaccinated are quarantined for 2 weeks, irrespective of whether their vaccination status. We are not doing that. We are saying that we are looking at many ways of reducing that. First is the 72-hour negative PCR, which tells us that you are not likely to be positive. You could be incubating and looking at the behavior of the virus. And
even after vaccinating?
Well, vaccination, no vaccine is 100%. And that's why I said 75% of the people who are coming in are unvaccinated. It means that 25% of the people who are positive are vaccinated, either one or two. But they are less likely to fall sick. They are less likely to end up with a severe disease. And so it still forms a certain buffer, major group that is protected. And so we do the test on arrival. And let me explain to you. Sometimes people ask, why do you test at the airport? Every country has a mechanism of testing you before you mix with the community. Some will say, go home and stay in your own home, we'll watch you for 10 days, and you know that country. Some will quarantine you for 2 weeks. Some of them, you go, they take you to a hotel for a day or two, you pay money for your PCR. When it's negative, you are released. It still comes to the same. Ghana decided that let's have a higher technology that allows you to leave the airport within an hour of arrival and getting tested. So it's about the same concept, except that people do it in different ways. There are countries where you go in for 48 hours or 72 hours, whether you are positive or negative, and then but they still test you. So it's happening in almost all countries, have mechanism of sieving people who are likely to be positive before mixing with the community. And so that's why we still look at that, because no vaccine, nobody has said vaccines are 100%.
Okay.
That's why we still institute that mechanism, more to reduce the number of possible entries into the country.
So that answers TJ Wara's question also about whether you don't trust the test at the airport, for which reason you are still testing those who have been vaccinated.
Yes, it is not because we don't trust it. It's because there are several steps in catching a very elusive virus. It's not a very straightforward virus. Now, the Omicron, we are told, has a shorter incubation period, and that's why US has dropped their PCR to 24 hours, UK 48 hours.
Okay. Yeah. But Sarah is asking about the appropriate legal regime in place for this. It's something that a lot of people, because we've seen Michelle's, comment, the UN Michelle Bachelet, she's asserting that forced vaccination is not acceptable. I've seen a lot of people making reference to that. Wow. We have a Public Health Act. But Sarah wants to know, is the appropriate legal regime in place for you to force someone to take the vaccine?
Depending on the situation you are in, the Public Health Act allows you to vaccinate anybody who needs to be vaccinated. And even if you refuse, I'm sure you go through, I think, Section 20 or so, there's a fine for that. If you go to some countries, you go there, when you go to Canada Airport, if you come here and are not vaccinated, you're supposed to be vaccinated. It is not that you choose or not to. There are some countries, they will vaccinate you, and then they will keep you until the vaccine becomes effective.
Which we are told is 21 days.
Is that 14 days. 14.
We don't need up to 21 days for it to be fully...
Well, I mean, the longer the better, but with 14 days, it's okay. And I've heard that story about, yes, it's not that we don't know about that 14 days. We are also balancing the effect on people and the policy. And that's why we did not add that long time. But mind you, most of them are taking 2 shots. By the time you take the first shot, you have protection, and you take a second shot. So it's as if it's not as if it's only after the second shot that you get some protection. And so we still have protection enough to prevent you from getting the virus.
So if I was preparing to come to Ghana from the UK or wherever for the Christmas festivities, if I take a shot today, can I still come in on the 14th of December? Or even on the 14th of December, if I take the first shot, can I still come into Ghana?
If you are not fully vaccinated, let's say Pfizer, you're taking Pfizer, Moderna, and those are 2 shots. If you...
One dose.
One dose, no. You are not fully vaccinated.
Come in.
We define exactly what is fully vaccinated. Yes. The only opportunity for you is Johnson & Johnson, which is currently a single dose. And so that's the only...
But does that need 14 days maturity also?
Ideally, that would be the best. But we are managing a situation. And so it's about managing the risk. And so you may decide that, okay, to reduce the number of stress on people, we can leave this one out for now. But we know there's a lot of protection. We still have other systems that still protect the people from coming in.
Okay, what would you say to those who are saying that this is just a way of preventing revelers, tourists, and others from coming into the country this particular festive season?
I think they should remove the people. This is a way of preventing importation of the virus, especially the new variant, into the country. If by doing so, people are affected, but that was not the intent. The intent is to prevent viruses from coming in.
But people carry the virus.
I know. So it's combined. So it should not be a deliberate effort to prevent my sister from coming to visit me or coming from anywhere. But if you saw January, March, I don't think anybody in this country wants to see that again.
Well, Frank JC is asking if you're going to vaccinate learners in basic schools.
Yes. Our current policy is 15 years and above.
Okay.
And so if you are in GSS, if you are in KIO, anywhere, if you are at home, a mechanic, learner, and you are 15 and above, you qualify. And that is currently ongoing in all regions.
15 years, and you don't need consent of parents, do you?
We engage schools engage PTAs. But mind you, there's also going to be the mandate of next March. I don't think we are in normal times. You know, because as long as your so-called rights affect my health, we cannot say because of your rights, I should just wait and you come and give me COVID disease, and then you say because it's your right.
Okay. Well, let's get into the next part of questions. A number of them, so we can take as many as possible. Stephanie Addo says, Dr. Nsiasare said on Newsfile yesterday that government will roll out a vaccine mandate from January next year. Can Doc share more on the modalities? Stephanie, Doc will do that. So we'll take the next one. Memuna Isaka says there are loads of events this festive season. Some have already happened with huge numbers, many not wearing masks. What is our plan to avert a fourth wave, especially with a new variant? Gabriel Kojo says, how do we intend to enforce the directive that people can't go to event without vaccination card? So many have already happened and there were no checks. Gabriel is asking. David Safo says, for people coming in, can there be exceptions on medical or other grounds? David. Sefa Mike will take the final one for this batch. He says, what is the update on the Omicron strain of the virus? Do we have community spread? And which areas have we identified as hotspots, if any? Sefa, your question has already been answered. 66 communities were sampled. We only found 7, we're told, but the communities will not be giving out just yet. We don't have hotspots, do we?
We will look at it from the report.
Okay. Well, so this issue about the modalities, first, Stephanie wants to find out. Yesterday, we had Dr. Nsiasare on January being a rollout for vaccine mandates. Can you share modalities?
I think on the 28th, we made an announcement of the mandate, and on 30th, the Minister of Health actually spelled out the mandate, which will come up in January at a date that he will fix, of course, based on the performance of that month's vaccination. And we have 2 groups. We have venues and we have people. So for the venues, we know cinemas, sports stadia, restaurants, and I think beaches and clubs. These are the venues that will be affected. Of course, that list can vary based on the kind of EI that will come up eventually. And then
so we are likely
people,
to see cinemas being closed again?
Oh, I'm not saying. Say you have to be vaccinated to go.
To go, okay.
That's what it is.
Okay.
I'm not saying to close that. You have to be fully vaccinated. When you watch football match and the stadium is full, everybody there is fully vaccinated. And they test before they enter. You see, so that is, and we also have people, all public government workers are to be fully vaccinated. All health workers, and I've told all our staff, are to be fully vaccinated, both clinical and non-clinical, because you have had the opportunity to get vaccinated. Commercial drivers will have to be vaccinated.
So all these groupings are being engaged? You are engaging,
engaging them,
staff?
yes.
We are engaging the transport sector.
All engagement is ongoing.
Okay.
And so schools, when we reopen schools, it's likely that based on the final research that the universities, SHS, and all those people will have to be fully vaccinated.
And
before.
teachers as well?
Of course, teachers, including the teachers. So, I mean, teachers are government workers. So even if you take them in the school, as teaching and non-teaching staff are all part of the group that will be affected. So you have them in that group. The issue is if you're going to watch a football match, you need to be vaccinated. And that's why we are spending this month giving more opportunity for people to get vaccinated so that it becomes more easier to do.
Okay, so
how do we look at it? It's simple. Everybody has a card, a verifiable card that you can verify by a person. Of course, and you need to carry an ID card to see that the card you are holding is yours. And there are systems in the database that can let us know whether it's yours or not yours.
But the short codes you put out, some people say they checked and it's still not working. There
are few. We've been correcting as many as possible. We had a batch that got a problem, and so we continue to tell people that go, if you scan and it's not coming, go to where you had a vaccination and it will be activated. Those who are traveling out of the airport, we have a whole desk there that continues to check and make sure your card is verified, because when you get out there, they will check your vaccination card. If it's not, you are not vaccinated. There are people who have been returned because they were not vaccinated. So Ghana is not the only one that is introducing this.
Okay, so there are loads of events this festive season. Some have already started. Some went yesterday, amongst others. Some say, Memuna Isaka, from his observation or her observation, says many were not wearing masks. What's the plan to avert a fourth wave, especially with the new variant?
I think the plan is not just for the health sector, but also for all of us to be. You may be asleep and your son will go clubbing and then come and infect you. And so we all have to be part of that engagement to ensure people adhere to the protocols. We have also engaged the tourism board, and we have strict rules for all those things. But I believe that they'll be reviewed. I mean, there is happening now.
Yeah.
And we will continue engaging. That's why we continue.
So Gabriel is informing us that some events, nobody checked vaccination card.
We haven't started that. That is in January.
In January.
So now the mandate is not now, it's January. So people are given the opportunity to spend this month vaccinating so that when the mandate comes in, you will not complain that I was not given the opportunity. That's why now we are carrying the vaccine to you. To the island, to your home, to the market, to churches. I'm sure you've seen churches where there are mosques and sports stadia. They are standing outside vaccinating people during the
But it's in December that we see all the huge gatherings and the activities happening and all. So do we wait until January to start implementing that and allow people to be reckless at this point?
Well, I think it is also fair that we had our first vaccine in March. Between, let's say, 2 months later, we've had a shortage of vaccines until the last few months, where we are about a month or two, where we've had vaccines and we are rolling out. So we need to give people the opportunity to vaccinate. It will not be fair to just go and lock people out when they've not had the opportunity to vaccinate.
So like last year, We are free to be reckless in December?
No, what I'm saying is that the mandates you are talking about, not many people have had the opportunity.
Are there any measures in place for the huge festive gatherings?
So we have
others?
discussions and rules with tourism authority to enforce those things. And that will continue and will continue. And as we study the situation, if there are more advice to come in, and I believe that we should start the protection from now, because if we don't start now, you see, by the time we start seeing the rise, it's already too late. And so all of us will have to be sure that we moderate our activities, we apply the protocols, we wear our mask, we ensure social distancing, because the situation is riskier now because of the importation and because of the fact that the festive season is going to bring in a lot of mixing up. And so people have to start now. And immediately post Christmas, people must, like I was explaining to you, you go in for the parties and all those things, and then after that, in January 1st, 3rd, you're about to work, and then you come to Joy FM and infect as many people as possible. And so we need to start. So workplaces and everybody must put in system to avert any cascade of infections.
Okay. Well, David, it brings us to David Sappho's question. For people coming in, can there be exceptions on medical or other grounds?
There are. I mean, if you are below 18, you are exempted, because most countries are not vaccinating people below 18. Okay. You are exempted. If you have any medical condition that we feel exempts you, of course, to be taken case by case. You cannot list those things, but when there are real issues, case by case, it can be considered. And as you look at the Public Health Act, it clearly states that.
Okay. Well, so that's another batch of questions down. Let's get into another. Hakuna Matata, this time on Twitter, says, what's the duration for the COVID jabs in the person as compared with the yellow fever that is 10 years? Hakuna Matata. Now, David says, nose masks are still expensive in some affluent vicinities. Is there any plan to come with a uniformity with regards to pricing? And that's David's question. Estinam says, now, are they ramping up their risk communication? Example, a lot of people do not know that we have vaccines or where to even go to be vaccinated. There also doesn't appear to be much engagement with people beyond the media announcement in Accra and Kumasi. Aseye says, why have they decided to vaccinate students aged 15 years and above? What is informing it? What about those not in school? Has the vaccination drive for this group taken off yet? What is informing it? How has it been received by parents or guardians, and how many children are they targeting and over what period? That's a fully loaded question there. Sophie says, the vaccine requirement for travelers to Ghana, why the rush without a legislative instrument? We've spoken about that, Sophie. Now, Suga says, how are they handling religious groups that are anti-vaccine? Suga's question. Maybe we'll start with Suga's question. Are you engaging or are you having issues with religious groups that are anti-vaccine?
Well, thank you. I mean, we continue engaging people that this is a compulsory thing, because it's a public health emergency that we are in. We continue to engage them to ensure that. So if during the mandate you break the laws, then you don't say because you belong to a particular church, be left alone. So we continue to engage them. And I think that's the best we can do, to continue to educate and inform them the effectiveness of vaccine and the importance of preventing themselves.
Have we had such instances? Have we had such cases?
Yes, we have had that, but I don't feel it is right for me to mention that. Okay. And I think they are aware that even how they themselves got so infected because of that. Believe, and I don't think I want to say it, but I believe that based on those engagements, we continue to engage all such groups to be sure that they change.
We still have people who have concerns about it, the superstition, the belief that this is to wipe us all out, amongst others. Do we still have such in your engagement? We've had
anti-vax for many years, but all our outbreaks have only been solved by vaccination, yellow fever, smallpox, measles, everything has been vaccination. It's one of the best tools that we have. And so we're going to have such people, but we also continue to engage. And that's why in our risk communication, I think it's also not fair for one to think that we are not engaging. We are not just in Accra. Ghana Health Services in every community of this country. We are in every district. And you have people who are engaging chiefs, who are engaging religious assemblymen, going to the community, engaging them directly. And that is why we are getting people vaccinated.
But people say that at least it's just the communities that are known, the hinterlands. We are not getting people going there and interacting. It appears that it's
maybe the media is also not happening. When we do the last presentation I did, I gave a full brief, every region by region, the number who have had first dose, the number of second dose, 16 regions. So it's not just in Accra. It's happening in all the places, and they are getting vaccinated.
I told you're doing a door-to-door in Kumasi.
Sometimes they are doing house-to-house. I mean, the region and the district looked at the situation they're in and designed their approach. If they feel that the farmers come from the farm in the afternoon, and so let's go there in the evening, let's go. They go and do that. If they feel that they will find them up in the Durban grounds or something, they devise their plan on how they will get to them. And so we've been vaccinating. In the last October, we did more than 2 million vaccination. We did a lot more in November, and we hope that this year, December, we'll do much more, maybe 3-4 times what we've been doing.
Well, so the duration for COVID jabs in a person as compared with yellow fever, that is 10 years. Hakuna Matata wants to know.
Oh, Hakuna Matata, you are a bit old-fashioned. Yellow fever is one shot for the rest of your life. So it's no more 10 years.
It's no more 10 years. Okay.
One shot for the rest of your life. Now, COVID is a new disease. This one disease, because of its severity and its impact, we have had to come up with vaccines, and people are still being monitored to see how long does the protection last. And so as we move on, we will see, and that's how we've had that the third boost in some countries are 6 months after the second shot. So we continue to learn, and I think it is not, we cannot wait to learn all that before we start vaccination. So because it's affecting the society, affecting people. So we continue learning and following the people who have been vaccinated to see how much. But if all of us vaccinate, we'll be able to cut down the transmission of the virus, and probably we don't have to worry so much about this perpetuating itself. But as long as people are decided not to vaccinate, they become a threat to the rest of the society, and it keeps on, the virus keeps mutating and keeps spreading in the society.
Okay. Well, but this one also from David says nose masks are still expensive in some affluent vicinities. Is there a plan to come with a uniformity with regards to pricing? Is his concern? Because we are required to wear it, but elsewhere it's this amount. We go to another side, it's another amount.
Well, I mean, this is a business question, but I believe that the prices, as more people demand, the prices go down.
But it must be a health concern.
It is a health concern, and that's why we distribute vaccines, masks for free, and we are happy to see people distributing free masks in churches. When they are having events, they're giving free masks. But I believe that maybe that's an area we need to engage the trade minister and then to see, is this something that we can make sure that we put a cap to make it more accessible to people?
Before, at least in the peak of the COVID last year, for instance, we used to have data on those that wear masks and between male and female and all. Are we still checking that kind of, are we still undertaking that kind of research? We know that at some point mask wearing went down. We all let down our guards.
And so now?
Yes. Are people picking it up? What are the statistics?
Well, the numbers are low, but the district do their own assessment periodically to see, and also use it to inform their messaging. But we are not doing the mass one that we used to do before. Periodically, we'll go and assess and see how this is. But we have also noticed that when the disease is going up, that's when people start picking up their masks. But the best thing is to pick it before
it starts going up.
It starts going up.
But what would you say to those who are saying that it looks like the entire focus is at the airport, for instance, in terms of not wanting to import it?
I don't think so. You see, we have continuous engagement. If you sit, you may be in Accra, you don't know what's going on in Kumasi, you don't know what's going on in Kawi, you don't know what's going on in other parts of the country. There's continuous engagement. There's case management. You continue to have cases that we are treating. You continue to do testing and continue to give education, flyers, etc., across the country. So we are doing a lot, and I'm sure we have also trained a lot of workplaces to see what system to put in place. What they need to do is to enforce it. You see, workplace system, we bring you guidelines, and I'm sure you have seen some factories, everybody, schools, we have given them guidelines, we train teachers on what to do. And so I think we all have to come together to ensure that we are able to implement all the things we've been learning the last 20 or so months.
Are we looking at boosters as a country also? Because those who are fully vaccinated, we are still seeing at least UK starting boosters tomorrow because the vaccines are not foolproof for Omicron, we're told. Okay,
so what I'm going to say is just maybe first and foremost, there's issue of equity. You want to target 20 million people. We have about 13 million unvaccinated now. Should the 6 million start getting the third dose, I don't think that will be fair. But we will look at the people who are at risk most. Maybe those based on their comorbidities, they have hypertension, diabetes, by their age. We can't come up and say, maybe this particular group, because of the peculiar risk they face, we can't isolate them and do it all. But
what if I want it? Can I just say that I want boosters, maybe I'm ready to pay for it?
If we need to qualify for a particular criteria that we'll put together to identify the people at risk who we all agree that will need a booster. Whilst we concentrate on every Ghanaian to make sure every Ghanaian get vaccinated. Those countries doing boosters, they have 80%, 90% coverage, so they can move to the next level. We are not reached there yet.
We are not there yet. Okay. So finally, we're really out of time, but the Asay's question, fully loaded. He was talking about the children and why you're targeting the 15 years and above, and how many children exactly we are targeting. Briefly, in 30 seconds then.
Well, even the 15 to 17, we are looking at about 2.6 million.
Okay.
From the census, about 2.6 million people. You see, a lot of them are in secondary schools. They will go to school in boarding houses, they are in classes. So it's another good community that spread can start from. Fortunately or unfortunately, they don't get sick much, and so they become the agent to distribute to others. And that is why we have moved to 12, so that to bring in this very active group of young men and women who are likely to be a spreader, also protect them. We can go up to 12 or 5, but that will be based on a few decisions that we need to do.
Dr. Patrick Abaji, we are grateful for your time.
Thank you very much.
We'll engage more, and hopefully we'll avert the fourth wave. And that's the Director General of the Ghana Health Service, Dr. Patrick Abaji, my guest tonight on The Probe. Another edition comes your way at same time on Sunday. For our radio audience, A Walk with Jesus is up next, please.